students, this is your Dr. Prats and welcome to my masterclass. Today we're going to start a very important series on odontogenic cysts. So cysts which arise from odontogenic epithelium is what we're going to talk about. And in today's class we're going to see how a cyst is formed, how is it initiated, how it expands, and what is the recent classification from WHO for the odontogenic cysts. Let's roll. So the cysts of the oral cavity includes not only odontogenic cysts but also non-odontogenic cysts. That we'll understand when we talk about the classification. So all our presentations are based on a questioning format. We always begin by understanding what is the pathology, that is nothing but the definition. The second question is, why do we need to know it? In this case, we need to understand the cysts of the oral cavity because as dentists, we come across it more often than the physicians. And some of the cysts are very aggressive in nature and are associated with some kind of a syndrome. And it is important for us to refer the patient to a general physician. That is why we need to know this pathology very well. The third question usually in all the presentation are three hows, that is, how did it occur, how are you going to diagnose it, and how are you going to treat it. But today we are just going to understand how the cyst occurs. This will be followed by brief summary and multiple choice question at the end. Every lesson has to have a learning objective, and for today's lesson, it is define a cyst, describing the basic concepts of cyst initiation, formation, and enlargement, and the latest classification of cysts given by WHO. It was Kramer in 1974 who gave the definition of a cyst. So he said that it is a pathologic cavity. It is not a normal cavity because there are a lot of cavities in our body. If you must know, there are a lot of anatomical cavities. So a cyst is not a normally occurring cavity. It is a pathologic cavity, and it contains either fluid, semi-fluid, or gaseous contents. It is not limited to any particular one. It can be either fluid, semi-fluid, or even gaseous. And this is not created by the accumulation of pus, which is very important because there is another cavity which is pathological and contains pus, that is nothing but an abscess. So that's how you differentiate a cyst from an abscess. That abscess contains pus and cyst does not form by the accumulation of pus. And it is frequently, but might not be all the time, lined by epithelium. So that forms the definition of cyst. When you're understanding the definition of any pathology, a lot of things come into picture. So you understand that it is a pathological entity which is like a cavity in appearance, and what are its contents, and its etiology is not by the formation of pus, and histopathology that it is lined by epithelium. And that is the reason why, students, you must know the definition of a pathology. It makes your life easier to remember the other things which are related to the pathology. So let me show you a picture to make you understand it better. So this is the cavity. Okay, so the lumen of the cyst, it is called as, which is nothing but cystic cavity, and that is surrounded or lined by epithelium. So it's called as an epithelial lining, and that is supported by a connective tissue wall around that. So there is a cavity followed by epithelial lining, and below that is the connective tissue wall or the capsule, connective tissue capsule. Again, another picture showing the same, the cystic cavity or the cystic lumen, epithelial lining, and the connective tissue wall or connective tissue capsule. So in this picture, basically it is depicting that the epithelial lining can be of so many different types. So it can be stratified squamous epithelium, or it could be pseudostratified ciliated columnar epithelium, especially in association with maxillary sinus. Or it could just be a few layer of any squamous epithelial cell. The classification given by Main and Kramer is accepted by the WHO and is still followed today. So it is broadly classified as developmental cysts and inflammatory cysts. So this is the main two classification, and under developmental cyst there is odontogenic cyst and non-odontogenic cysts. So the odontogenic cysts are odontogenic keratocyst, follicular cyst, eruption cyst, alveolar cyst of infant, gingival cyst of adults, and developmental lateral periodontal cyst. Non-odontogenic cysts, this we will study at the end of all the cysts, that is mid-palatal cysts of infants, nasopalatine duct cyst and nasolabial cyst, and inflammatory cyst, that is follicular cyst, radicular cyst, and inflammatory lateral periodontal cyst. Let's start with the pathogenesis. It is classified into three different steps or stages, you can call it as: initiation of the cyst, that is starting, formation of the cyst, and enlargement of the cyst. So these are the three stages of the pathogenesis of a cyst, or how a cyst is formed. The cyst initiation is mainly by the cell rests. So from the oral histology, again, we have to go back. A flashback is required at this point of time. So this is the enamel organ. Yeah, this is the Bell stage. So there is dental papilla, there is dental sac, and this is the enamel organ. And this is your dental lamina, which is connecting the enamel organ to the oral epithelium, correct? So as soon as the hard tissue formation begins, the dental lamina starts disintegrating. Okay, so this forms clumps of cells which are seen especially within the periodontium and other soft tissue within the oral cavity. So these remnants of dental lamina are called as cell rests of Serre. The other cell rest which we know of are cell rests of Melasses. So these are the remnants of Hertwig's epithelial root sheath. Hertwig's epithelial root sheath is what forms the root, and once the root formation is almost completed, the sheath disintegrates to form clumps of cells, and that is called as cell rests of Melasses. So these two cell rests have the capacity to proliferate all their life. That is the unique feature of these two cell rests. Whenever there is any kind of trigger, they're capable of undergoing proliferation. So this is how they occur. So this is the periodontium, as you can see, and you can see that they occur as clumps of cells. So these are the cell rests. Enamel organ itself could also be a reason for the cyst initiation, and even the basal cells of oral epithelium could contribute. So all these are different factors which are responsible for the initiation of the cyst. Let's see how the cyst forms. So there is a proliferation of the cell rests or any other cells which are capable of undergoing proliferation with a high mitotic index, and these eventually form a sphere of cells. So this sphere, as it grows bigger, there is a lack of nutrient which is reaching the center of the cell. So as you can see, it has grown very big, and the surrounding connective tissue is incapable of reaching the nutrient to the center. That results in the death and desquamation of the central cells, and that results in a central liquefaction necrosis. So now a cavity is formed. Okay, so there was a proliferation in the beginning, a sphere is formed, and central cells do not receive nutrition and undergo a cavity formation. Let's see what happens next, how this becomes enlarged to form a cyst, a complete cyst. So once the cavity is formed, there are several factors by which there is an enlargement of the cyst. Okay, and eventually that is lined by this epithelial cells which were around the cavity, and the connective tissue wall around it to complete the cystic picture. So the first explanation is that there is an attraction of fluid into the cystic cavity, that is ingression of fluid. So because of this, the fluid gets retained within the cavity. There are some factors which are responsible for this that we'll discuss later, but remember that there is an influx of fluid and there is a retention of this fluid. This increases the hydrostatic pressure within the cavity, right? And this hydrostatic pressure in turn results in the expansion. So it's not just the fluid influx, it's also the hydrostatic pressure. Both of them together result in the expansion of the cyst. The next factor is the resorption of the surrounding bone. So this is a cyst and it is present within the bone adjacent to the tooth, and the bone, is a hard structure, so there has to be some amount of resorption of bone for the cyst to enlarge. So the cyst releases prostaglandin E2 and 3 among all other bone resorption factors. This results in osteoclast activation. Osteoclasts are the cells which results in bone resorption. So they resorb the bone around and hence results in further cystic enlargement. I hope that is clear. And these are all synthesized by fibroblasts which are present within the capsule, that is the connective tissue capsule, and also by PMNLs and monocytes. The other theory, which was explained by Main, Harris, and Polar, said that increased hyperosmolarity further draws in the fluid from the surrounding tissue because the cyst wall acts like a semi-permeable membrane. So this increased hyperosmolarity depends upon the amount of protein which is present. So based on the amount of protein, either the fluid is retained or it is pushed out. So those were the theories of cystic enlargement. So let's just go through a quick summary of the cyst formation, initiation, and enlargement. So the initiation happens because of the cell rest of serrae, cell rest of molasses, basal cells of oral epithelium, enamel organ itself. Once the proliferation results in a big sphere, the central cells stop receiving nutrition from the surrounding connective tissue, resulting in a cavity. This cavity enlarges by different mechanisms, mainly by the ingression of the fluid which is retained inside, resulting in increased hydrostatic pressure that further enlarges the cyst. The second explanation is by the bone resorption. The surrounding bone is resorbed by the prostaglandin E2 and E3 which are released from the cyst, that activates the osteoclasts and results in resorption. And the third is by the increased hyperosmolarity, which depends upon the protein content within the cystic cavity. So that's how a cyst is formed. Like I always say, do not get overwhelmed by all the information. Remember, we started with understanding the definition of a cyst, that it is a pathologic cavity. It can have fluid, gas, or semi solid substance within it. Not necessary that it should be always lined by an epithelium, but it frequently is. And differentiation factor is that it is not formed by the accumulation of pus, which is nothing but an abscess. Okay? Etiopathogenesis was classified into initiation, formation, and enlargement, which we just discussed. And classification by WHO is broadly classified as developmental and inflammatory, and under developmental there is odontogenic and non-odontogenic. Again, the table is put up for your reference about the classification. We'll be studying all these cysts in the coming presentations. So the MCQ for today is: increased hyperosmolarity further draws in the fluid from the surrounding tissue, as the cyst wall is a semi-permeable membrane and is associated with the increased content of which one of these? Is it interleukin? Is it tumor necrosis factor? Is it transforming growth factor? Or is it protein? So although these might be very tempting to select, especially tumor necrosis factor or TGF, you might think that these are sounding very important and maybe that is the answer. But although these are all indirectly responsible in the cyst etiopathogenesis, but the hyperosmolarity itself is because of the protein content. So the answer is protein. Just a sneak peek of what's coming ahead. This is a pie chart which is showing you the occurrence of the cysts and the percentage. So as you can see, radicular cyst makes up for the most, that is 52.3%, followed by the follicular cyst or the dentigerous cyst, and then the keratocyst. So we'll study all of them in the coming presentations. So stay tuned, and if you liked my today's presentation, please like and subscribe and share it with your friends. Ask me any doubts in the comments below, and also let me know if any other topics you would like me to explain for you. And for more such MCQs, please visit my website, and there are plenty amount of MCQs for you to practice and learn. Thank you, and keep smiling. These are, of course, some of my references for today's presentation. All standard textbooks of oral pathology and a curricular textbook for the cysts of the oral region itself by Mervyn Shia. Thanks again.